is going to encompass your GI and GU assessment. Always be sure to do the preliminary things to meet your check off requirements, but I'm just going to focus on the assessment. You would do hand hygiene, and you could wear gloves for this also. So I'm going to start with inspecting. I'm going to inspect the umbilicus. I want to note that it's midline. I'm also going to inspect the skin for any dilated veins, which could be due to ascites, which is inflammation of the abdomen. I'm going to check for any lesions, such as rashes or bruises. I'm going to check the color. The skin should be appropriate for ethnicity. If it was yellow, you would be concerned for jaundice, which would be due to liver failure. Blue would indicate cyanosis or a lack of oxygen. Next, we're going to move on to auscultation. So typically we would do percussion and palpation next, but because we're doing the GI system, we always auscultate off after inspection, because when we palpate, we can cause false bowel sounds, which may, because we're moving the bowels around, when we go to listen after palpating, we may hear bowel sounds that aren't actually there and miss something such as a bowel obstruction. So I'm going to start in the right lower quadrant. I'm going to listen until I hear bowel sounds. There's 5 to 35 gurglings every minute, depending on the patient. If you don't hear anything, you would have to listen for 5 minutes to say that the bowel sounds are absent. I'm going to go in a clockwise method and listen all around. What's normal is that you should hear bowel sounds that are normal in all 4 quadrants. Next, we're going to percuss, and so with percussion, you're going to use your index finger and your your middle finger and your pointer finger. You're going to place it over a location, and over that location, you're going to take the next 2 fingers and tap to elicit a sound. So we would do it in the same fashion all around. And for there's different things you can hear with percussion. You can hear tympany, which is going to be over the gastric bubble. And you can also hear dullness. Tympany would indicate that there's air. You can hear resonance, which would be air and fluid, and then you can hear dullness, which is a thudding sound, and that would be over any fluid, liver, or spleen. You want to hear tympany in the gastric bubble and over the intestine, so we would be looking for tympany as our normal here. Last, we're going to palpate the abdomen. We're going to start off with light palpation. If your patient has, for instance, pain in the left upper quadrant, you want to start in the right lower quadrant away from the pain and ease up to that site. So when light, you're just going to go down a little bit, 1.3 centimeters approximately, and you're going to be seeing if the patient is guarding. You want to inspect if the patient has any guarding or splinting when you're doing it, if they're grimacing. You may feel something. If you do feel something, you want to know what quadrant you're in. After light palpation, you're going to go into deep palpation, where you're going to go deeper. And at that point, you're going to be looking for any masses or seeing if you feel any nodules or anything. When you're all done with palpation, you want to know how the abdomen felt, if it was soft. You also want to note the shape of the abdomen, so if it's rounded, if it's flat. This video is going to encompass the GU portion of the assessment in addition to what we did for GI. So first we're going to start off by palpating the suprapubic region, which is going to be right above the pelvic bone. You may feel the bladder if it's full. If it's not, you won't feel anything. And then you also want to ask your patient if palpating over this causes any pain. And again, the suprapubic region is right here above the pelvic bone. Next, you're going to sit the patient up and you're going to assess for the coxa vertebral tenderness. So there is an angle at the end of the 12th rib. There's going to be an angle here that forms, and right under that angle is the kidneys. So you're going to find the last rib. If it's here, you're going to look at the angle because you have your spine coming here in your 12th rib. There's going to be an angle here. You're going to place one hand over that area, and you're going to strike your hand and ask the patient if they have any pain. And then you're going to come up to the other side and do the same thing again, asking the patient if they have any pain.